everyone, my name is NIKITA DCRUZ and I work as a pediatric physiotherapist at UMMEED Child Development Center. Today I want to present my work which is titled Pediatric Physiotherapy from a Caregiver's Lens, a Case Study. As a fresh graduate from physiotherapy school, my understanding of pediatric physiotherapy was a compilation of exercises and protocols. But as I started working with children and families, I realized that children need to be viewed holistically in the context of their environment. To do this, I was using play in my sessions by building on the child's interests and being responsive to the child's cues during the sessions. I also partnered with families and tried to look beyond motor milestones. And while I felt that these were really important to me, I wanted to explore and understand how a caregiver perceives pediatric intervention. And this led me to my objective, which was to explore a caregiver's understanding of physiotherapy intervention received at a child development center based in Mumbai, India, using a case study. The inclusion criteria involved interviewing a family whose child had received a year-long intervention and was between the ages of 0 to 3 years. For this, we reached out to 3 families by calling them and stating the purpose of the study. Due to certain logistic difficulties and based on the family's availability, one of them volunteered to be a part of the study. The caregiver interviewed was someone who enjoyed listening to music, drawing, and singing and was a mother of 2 children with special needs. The intervention was an hour long and was divided into 2 parts. The first 50 minutes was spent with the child using the principles of neurodevelopmental therapy, and the last 10 minutes was spent discussing with the mother about the activities done in the session and how we could do the same at home. An informed consent was obtained from the family for conducting the interview, to video record it and to use the pictures of the family during the presentation. The interviewer used a semi-structured interview guide with the questions trying to get the participant to describe her understanding of physiotherapy, explore the ideas around physiotherapy intervention, to identify her hopes from therapy and get a sense of feedback related to intervention. The interview was conducted in Marathi and was transcribed verbatim and translated to English. Thematic analysis was then employed to draw out the emerging themes and sub-themes using an inductive approach. The data collected was analyzed and triangulated between the co-authors independently to draw out themes. They were then member checked. Result: there were 4 themes that emerged through the interview, and I will be speaking more about them in my subsequent slides. Physiotherapy, motor and mood. The caregiver acknowledged that she had experienced a shift in the understanding of physiotherapy, moving from addressing only motor concerns to identifying the need to work on other areas of development such as cognition, self-care and communication. And this was understood when she says she should be able to eat something by herself and she should be able to mix with other people. The caregiver also believed to move beyond motor milestones, the sessions need not be limited or restricted only to mechanical exercises. And this was understood when she said that using interactive ways to build understanding rather than mechanical exercises. Physiotherapy and playfulness. The caregiver was able to identify and understand the importance of toys in building up the child's arousal during sessions and at home. The toys provided the child with an intrinsic motivation to move. This came up when the mother said that attraction to toys has woken her up. Her attraction gave her the motivation to get up. To add to this, the caregiver also understood that while the toys helped the child to learn a skill, they were not needed after the child has learned the skill. And this was evident when she pointed out by saying that now at home stands even if toys are not there, but it started with toys. Joining hands with caregivers. While partnering with caregivers, both the therapist and the caregiver has important roles to play to support the child's development. The caregiver and the family observed the child at home and related the information regarding the child's interests and development to the therapist during the discussions in the sessions. The information provided was utilized by the therapist during the sessions to work on some of the skills during intervention, and the contribution was evident when she said that at home S used to play with piano, which has sound, color and light, and X used to move around him most of the time. Then in the sessions, use these light and music toys helped her to get the toy. She would then sidewalk, then began to stand and sit. The caregiver recounted instances where the therapist was able to share her technical expertise regarding development, which enabled the caregiver to understand the importance of identifying the missing components and targeting them specifically. This came up when she said that this only, for her crawling, we worked on her abdominal muscles. She was not able to do any of this. She used to get up directly. Then Z told us that for standing, we need to help her to come to sit first. So let us try this at home. To add to this, she also noticed how the mother and the therapist were able to determine the next steps for intervention together when she says, we think how to move forward. Learnings. Through the interview, we were able to recognize that since the caregiver was a mother of 2 children experiencing disabilities, we realized that she had limited time to interact with her children. This was realized when she said that since I do not get a lot of time, getting more time calling her. This is a factor that should be accounted for while constructing a home program for families. A further interaction with the caregiver led to a conversation where there was a need to identify additional caregivers for the child, and this was realized when she said that more house members during home visits. While the mother found value in home visits, she expressed an innate requirement to discover more activities to do at home with her child. This hope was understood when she pointed out by saying she comes at home and tells what more can be done within the house. Conclusion. The caregiver and the therapist were able to explore that pediatric practice is not limited to only achieving motor milestones, but it can simultaneously build on understanding communication using interactive ways, playfulness, and partnering with families. Limitations. Gaining other caregivers' perspective on pediatric physiotherapy practice. Acknowledgements. I would like to thank Dr. Vibha Krishnamurthy and my other colleagues back at UMMEED Child Development Center for their continued support and encouragement. And I would also like to thank the participant for participating in this study with us and sharing her valuable experience. Thank you.